We begin with a change in course for the state of Ohio. The Department of Mental Health and Addiction Services issuing new guidelines for gender-affirming care for adults after a flood of public comments. The original guidelines would have made Ohio only the second state in the nation to restrict this type of care for adults. 2 News reporter Aaliyah Seabrooks is joining us live in the studio right now as to why that old previous law is not going to be happening now. Aaliyah?
John, the Ohio Department of Health says they received nearly 4,000 comments from the public asking them to change their proposed guidelines. And the department says they listened.
Coming off any care can be dangerous, especially doing it rapidly.
TJ Darling works with families through Trans Allies of Ohio. They say families who need access to that gender-affirming care are considering leaving the state. This is in response to increased efforts by state officials to restrict that care.
Finding out that, you have to move right now or you can't access care, it's dangerous.
The original plan would have required multiple medical professionals to help create gender-affirming care plans for patients. It would also require patients over the age of 21 to receive at least 6 months of counseling before starting hormone treatment or receiving gender-affirming surgery. In January, the Department of Mental Health and Addiction Services allowed the public to weigh in with their opinions, and they did so strongly. Wednesday's revised regulations changed the requirements to only apply to minors. In a statement, Planned Parenthood advocates of Ohio applauded the efforts of the department, saying in part that, quote, Ohioans deserve access to quality, affirming health care informed by medical best practices, not politics. Additionally, the Greater Dayton LGBT Center says, quote, medical decisions and autonomy over one's body should be a fundamental right of each individual, not a political vote grab. Ultimately, Darling says these restrictions will not deter those who need the care the most.
Banning care does not mean that we're not going to try to find it. It just means that we're going to go to possibly unregulated sources to get what we need.
A new period for public comment is now underway and will be available until February 14th at 5 p.m. In studio, Aaliyah Seabrooks, 2 News.